Got a weird, mysterious lump or bump on your skin and literally no idea what it is? Well, trust me, you are definitely not alone. We're going to crack the exact code on what these growths are, where they come from, and how to safely get rid of them. So maybe it just popped up out of nowhere, or maybe it's that one annoying spot you've been picking at for years. But here's the thing, identifying it correctly is absolutely crucial. Because if you treat the wrong bump the wrong way, you are setting yourself up for a major skin disaster. Hey, really quick, if you want to understand your body better and catch these weird skin signs early, hit that like button and subscribe. Stick around for this whole explainer, because I promise you're going to walk away knowing the exact causes and the absolute safest medical solutions for these mysteries. Okay, to make sense of any skin bump, we've got to establish a golden rule of anatomy. The difference between your skin layers is actually pretty simple. On the surface, we have the epidermis. Now, the key here is it has absolutely zero blood vessels. Deeper down, that's the dermis. That's where your hair follicles and roots live. Keep this rule in the back of your mind. It totally explains why some shallow bumps can literally just fall off without bleeding, while the deeper ones need, actual surgery. Section 1. Skin tags, harmless overgrowths. So the big takeaway right off the bat, skin tags are completely harmless. Structurally, they're just soft, kind of floppy little overgrowths of totally normal skin. They absolutely love areas with a lot of friction, think your neck, armpits, or groin folds. And while they usually start super tiny, just a couple of millimeters, they can actually grow pretty big if they're constantly irritated by tight clothes rubbing against them. But remember, under a microscope, it's just normal skin. Now, you might be tempted to jump on Amazon, buy one of those freezing kits, or, no joke, use a rubber band to choke it off. Please don't do that. Dermatologist Dr. Danny Guo warns that patients who try these DIY hacks often show up in his clinic with super nasty skin infections. Taking matters into your own hands can literally turn a completely harmless piece of skin into a painful, infected nightmare. Instead, getting them professionally removed is so fast and simple. A doctor just injects a tiny drop of numbing medicine, cleanly snips it off with surgical scissors, and gives the base a quick buzz of cautery. Boom, that's the whole shebang. It's fast, it's sterile, and most importantly, it's safe. Section 2. Seborrheic keratosis, barnacles of time. You've probably heard people call these age spots or even warts, but spoiler alert, they are absolutely not warts. A seborrheic keratosis is a harmless overgrowth made entirely of those surface-level epidermal cells we talked about earlier. Visually, they look like these waxy, crusty, brownish-gray spots that look like they were just glued onto your skin. And because they sit strictly in that top, bloodless epidermis layer, sometimes they just naturally dry up and fall off or get accidentally scratched off without even bleeding a drop. This actually brings us to a super fascinating fact that ties right back to our anatomy rule. Removing one of these from your scalp will not cause hair loss. Why? Well, because the growth is just sitting on the surface epidermis, while your precious hair follicles are tucked safely away deep down in the dermis layer. A doctor can literally just scrape the bump off without ever touching the hair roots. So when it comes to getting rid of them, there are some pretty fantastic rapid-fire options at the clinic. Because those roots are so shallow, professionals can use blades, lasers, cautery, or even a blast of liquid nitrogen to freeze them right off. And the cosmetic results are incredible. Because it's all on the surface, the skin usually heals perfectly flat without any deep scarring. Section 3. Dermatofibromas, deep dermal bumps. Okay, but what happens when a bump goes deep? We're diving further into the skin now. A dermatofibroma is a firm, semi-permanent bump that lives in the deeper dermal layer, and it's actually often triggered by a really minor skin injury, like nicking yourself while shaving your legs. Because they live deep in that dermis layer, they feel exceptionally firm, almost like a little pebble or hard scar tissue trapped under your skin. And they can actually be pretty itchy or really hurt if you accidentally bump them on a table edge. So here's a massive myth we need to bust right now. You cannot just casually freeze these things off. Because they're deep dermal lesions, freezing or lasers will barely even scratch the surface. Like Dr. Guo says, trying to cut it out means you'd essentially just be trading a dermatofibroma for a surgical scar. Excision definitely works, but it leaves a permanent mark. So the best medical advice, stop the friction first. Eliminate the tight clothes or rough shaming irritation before you even think about rushing into surgery. Section 4. Milia. Trapped superficial cysts. All right, let's move up to the face for this tiny little bumps that everyone misidentifies and aggressively tries to pop at home. Now, a milia and a standard whitehead might look exactly the same in the bathroom mirror, but mechanically,
total opposites. A whitehead is just gunk clogged in a natural pore. You squeeze it, it pops out. But milia, they are trapped superficial cysts. There is zero natural opening to the surface, and the white stuff is trapped inside a tiny, tough sac, which explains why squeezing them with all your might never works. You're just violently damaging your skin for absolutely no reason. So how do the pros handle it? It's all about precision. Step 1, they make a tiny, microscopic nick in the skin right over the bump. Step 2, they pull the entire intact sac out. And that right there is the secret. You have to get the sac. If you just poke a hole and squeeze the white stuff out, the milia is going to grow right back because the container is still hiding under your skin. Section 5. Warts. Viral invaders. Let's kick the energy up a notch because this last condition is a literal viral invader. Unlike the harmless stuff we've talked about so far, warts are highly contagious. They're caused by an infection from HPV, the human papillomavirus, and they spread through direct physical contact. What's wild is that they actually set up camp right in the middle of your skin and physically push your normal skin out of the way. When you get these on the bottom of your feet, plantar warts, they get incredibly thick. Since you walk on them all day, it honestly feels like you've had a sharp little rock superglued inside your shoe for years. But wait, how do you know if it's a wart or just a normal callus from wearing tight shoes? Here's the ultimate visual mythbuster. A wart usually has these tiny black pinpoint dots right in the center. Those aren't seeds, they're actually tiny burst blood vessels feeding the virus. Oh, and warts interrupt your natural skin lines, kind of like your fingerprints. A callus is just thick, normal skin, so your skin lines will run continuously straight across it. If those lines detour around the bump, yep, you've got a wart. Since warts are stubborn, viral infections, scrubbing them with your standard 2% salicylic acid body wash is pretty much useless. You need the heavy-duty stuff. We're talking 20% plus salicylic acid patches, crazy strong duct tape occlusion to suffocate it, or serious clinical firepower like liquid nitrogen freezing and vascular lasers. It takes a lot of patience, consistency, and honestly, usually a professional's help to completely wipe them out. Which brings us to the biggest takeaway of this entire explainer. Proper identification 100% dictates the treatment. What works like magic for a surface-level skin tag is going to fail miserably on a deep dermatofibroma, and trying to pop a milia is just going to leave you with a nasty scar. Seriously, leave the removal to the pros. It'll save you from infections, permanent scars, and a whole lot of frustration. Before we wrap this up, I want to leave you with something to think about. Are those tiny, pearly clusters of bumps on your kid's arm just a harmless rash or a highly contagious virus spreading like wildfire across the playground? We are diving deep into the crazy world of Molluscum contagiosum next time, so make sure you're subscribed. And hey, drop a comment below and let me know if you've ever actually figured out what one of your mysterious skin bumps was. Finally, just a quick reminder, this explainer is here to give you general medical info to help you understand your body a little better. Always check with your actual doctor or a board-certified dermatologist for personal medical advice. Thanks so much for hanging out with me on this explainer, and I will catch you in